First day of October also marks Menopause Awareness Month. Menopause marks the end of the female reproductive years, but many people don't really know what to expect until they are in the middle of the new storm. So Dr. Lanasha Tanner from Touro joining us now to give us some insight into navigating menopause. Dr. Tanner, thank you so much for being here. We've covered perimenopause pretty often in the last couple of months. Talk about how that transition goes, what it looks like from perimenopause to menopause.
So pretty similar. Perimenopause is the period of time or that transition before menopause, which is the cessation of menses. So women in perimenopause will have irregular menstrual cycles in addition to symptoms of menopause such as vasomotor symptoms, sleep disturbances, mood challenges. Once women branch into menopause, the difference is there's no longer menses involved, however the symptoms persist.
Okay, so when you say if hot flashes is the vasomotor symptom,
yes.
And that's something that we hear about. You know, people make jokes about it, people suffer with it. Things are getting less taboo, which is wonderful. But there's also a downside to it. The market is flooded with supplements right now. How do you know what is actually a good supplement to take to get you through menopause?
Well, the good thing is that we're normalizing these symptoms and there's things on the market to help. However, everything good that's marketed as good is not. And so definitely I would start by saying talk to your healthcare provider about the evidence surrounding these supplements, because although these supplements may be marketed to help one thing, there may be side effects associated with them as well.
Sure. So obviously a debunked study as far as hormone replacement therapy. What's your take on using hormone replacement therapy in menopausal women?
Menopausal hormone therapy is indicated for the management of moderate to severe vasomotor symptoms in the appropriate candidate. There is evidence that does support it. Once again, speaking with your healthcare provider to see if you are a candidate for it, and individualizing what symptoms you're having in order to determine what medication or what regimen may be best for you.
What's the norm?
The norm? It depends on the symptoms. So for severe to moderate to severe vasomotor symptoms, hormone therapy in the form of a combined estrogen and progesterone formulation, or if a patient has had a hysterectomy, estrogen alone. There are so many different routes of administration, whether it's topical, whether it's by mouth. So just speaking with your provider on what's the best thing for you in the setting of the less side effect profile.
Are there any other risks that increase when someone hits menopause? Any other tests that you should have performed so that you can stay healthy through those years?
Yes, so your risk for menopause, depending upon the length of time you're in menopause, of cardiovascular disease increases, your risk of osteoporosis as it relates to bone health increases as well. So making sure you're staying up to date with your preventative health screenings, such as bone density scans, making sure that we have a lifestyle of just exercising, eating the right things, taking our vitamins, if that's kind of where you are at that point, at that stage in your life, with taking supplements to kind of help with those things.
So biggest message is go talk to your doctor about the options.
Yes.
But we're not crazy.
We're not. We are not crazy.
These are big changes.
Yes.
Dr. Lanasha Tanner from Touro, thank you so much for being here.
Thank you so much for having me.